But can I just ask the doctor? I mean, I'm surprised that you are a doctor. I believe in preventative medicine, and I think that RFK Jr. does a really good job of hiding the ball when he says things like chronic disease. I absolutely believe in that. The number one way to stop chronic disease is to have access to a doctor, to have regular checkups. 40 million people in Texas alone are uninsured. And a lot of them buy into some of the quack science that RFK Jr. is trotting out there, which is why if you were in West Texas, you should know that there is a massive amount of people who don't get vaccinations. And that's why we've got a measles outbreak right now.
Francesca Fiorentini recently took the stage on Piers Morgan Uncensored, facing off against a powerhouse panel including wealthy entrepreneur Brian Johnson, MAGA business tycoon Grant Cardone, and Trump's coronavirus response coordinator, Deborah Birx. Today, I want to zoom in on a segment where they tackled discussions about RFK Jr. and his potential influence on our nation. Let's dive in and dissect their conversation, breaking down each perspective and what it means for us.
When I first interviewed him, I was very skeptical. I'd heard a lot of stuff about him being a crazy conspiracy theorist and so on. I've interviewed him probably 4 or 5 times since then, and I didn't get the feeling I was with a madman. I got a feeling I was with a guy who's immersed himself into health issues for many decades, that he has some opinions which others don't like, but that broadly speaking, he comes from a good place of wanting to make America a healthier place. What's wrong with that?
No, I don't think there's anything wrong with it. I think he is the picture of health himself. I mean, he's a roided up 70-year-old who doesn't believe in germ theory and eats roadkill. I think that is perfect. He sounds like he's speaking into a fan half the time, and he doesn't believe in vaccines. He wants to replace healthcare in this country with Ozempic. And he also wants to limit access to antidepressants and psychiatric meds for all Americans and replace it with things like meditation. If we think we have a mental health care crisis in this country now, just you wait until RFK Jr. is finished with this country. If you think there is some sort of drug epidemic, people are going to be buying Adderall on the black market in insane amounts. He also thinks that Jewish people and Chinese people can't get COVID. That was a fun one. You should tell that to my uncle. Oh, wait, he's dead. Also, 83 Samoans also dead from the anti-vax work that he did in American Samoa. Just as there's a measles outbreak in Texas right now because of the kind of lies about vaccines that he has spilled. But honestly, Piers, other than that, truly a picture of health.
Right, well, you certainly painted a rosy picture of the forthcoming health secretary. Deborah, let me ask you. I mean, look, you're a medical expert. You specialized in HIV, AIDS, immunology, vaccine research, global health. I remember you obviously center stage in the Trump COVID era. What do you make of RFK? I mean, do you think he's dangerous? Is he misguided in some areas? Is he broadly right? What's your overview of him?
Well, you know, we're finally having the discussions that we needed to have, frank discussions about the health of this country. I got to travel the country for many months during COVID, working at the state level and the community level. And what I witnessed was a lot of undiagnosed disease that could have been treated early, that then resulted in COVID deaths. And I saw a health system that had completely deteriorated in our rural areas. Our rural areas really don't have access to healthcare anymore. And the hub and spoke model that we had set up to get really sick people into the regional medical centers, they were overwhelmed themselves. So COVID pointed out a lot of our issues with chronic disease. Like with early HIV, when we started, we were only treating those with symptoms. Well, that was the tip of the iceberg. When we finally started working and finding asymptomatic individuals and getting them on treatment early before they had evidence of disease, they could thrive. So what I'm hoping is this is a moment we work with Americans to reverse those early signs of disease and prevent the progression. And then we won't have frank diabetes and hypertension and stroke. We'll have a very different outcome. I see you shaking your head, but I actually have data. And so data, I think, trumps. I'm right now in West Texas, was out in West Texas for the last year, documenting the number of people who have asymptomatic early diabetes 58% in this community, a rural community that was picked relatively at random, 58% of individuals already had pre-diabetic or diabetic states, and another 60% were already hypertensive. None of them knew they were. They were all in their 30s, 40s, and 50s. This is our moment where we can actually tackle the issues that everyone has been ignoring for more than 2 decades.
But can I just ask the doctor? I mean, I'm surprised that you are a doctor. I believe in preventative medicine, and I think that RFK Jr. does a really good job of hiding the ball when he says things like chronic disease. I absolutely believe in that. The number one way to stop chronic disease is to have access to a doctor, to have regular checkups. 40 million people in Texas alone are uninsured. And a lot of them buy into some of the quack science that RFK Jr. is trotting out there, which is why if you were in West Texas, you should know that there is a massive amount of people who don't get vaccinations. And that's why we've got a measles outbreak right now. So
let's dive back in and get this right. Francesca Fiorentini is spot on here. And it's something Dr. Birx is just dancing around. They're all about having a broad conversation about health, right? Discussing prevention, which is fantastic. Imagine having RFK Jr. crisscross the nation as a health ambassador, promoting exercise and good nutrition in schools and rural areas. That sounds perfect because, yes, we desperately need to address the abysmal state of nutrition and exercise. But here's the real issue they're skirting around, which Francesca Fiorentini isn't shy about addressing: the structure of our healthcare system, specifically insurance. This is the big elephant in the room. In my rural state, nearly all the hospitals and clinics are being scooped up by one university. Soon, they'll monopolize the market and can jack up prices as they please. This trend is happening all over. Major corporations or universities, which are essentially corporations nowadays, are dominating and can charge exorbitant fees because they lack competition. Even for those of us with insurance, navigating healthcare is a nightmare. I have the best insurance available in my state, and it's still subpar. I recently had some minor health issues, went through a slew of tests, and though everything came back clear, my symptoms persisted with no explanation. Yet, I was slapped with an $800 bill, sometimes $1,200 after insurance. Now, I avoid going to the doctor unless it's absolutely critical because even preventive care is ridiculously expensive. Here's the harsh reality. Without insurance, seeing a doctor would be out of the question unless it was a dire emergency. This is the critical issue that administrations, whether Trump's or anyone else's, refuse to tackle. Why? Because the insurance companies, the profit-driven hospitals, and the pharmaceutical behemoths, they've got our healthcare system in a chokehold. And that, folks, is the real sickness plaguing our country.
So in order to say, okay, you were the COVID, we know you're the COVID lady, right? I'm not trying to come down on you on that. I think you could have done a lot better of a job. You obviously were responsible for papering over Trump's worst wiles, like injecting bleach into, your system in addition to ivermectin. Please don't at me, all the ivermectin psychos. And, we know he liked you because you wore a pretty scarf and, you're nice to look at. And that's great. But you're also a doctor and you have a responsibility. So you have to tell the American people that it's the fact that they can't get access to affordable meds. They can't get access to a doctor without charging them an arm and a leg for basic things. If you need, let's say, a CT scan or an X-ray, right? If you have all kinds of just basic things, that you're not allowed to get that without being charged an arm and a leg. I've done work on this as a journalist. I've interviewed people who refuse to go to the doctor because they cannot afford it. RFK Jr. does not believe in healthcare for all people. He says it's too expensive. Meanwhile, he wants to hawk everyone a bunch of supplements, and under his FDA, I'm sure a bunch of stuff is going to be approved of.
Okay, well, before I go to the other two guests who've not had a chance to contribute yet, I think it's only fair that, Deborah, you get to respond to that. So what would you say?
It's always disappointing to me when you have to degrade somebody to actually have a clear discussion. What I'm trying to be very clear on is there are people with insurance who are.
Grant Cardone nodding his head here. Oh, don't degrade people when he goes on social media all the time and it's the liberals, the socialists, the left. Give me a break.
Undiagnosed, because they don't have time to go to the doctor because they're working 7 days a week. So we have to, in the medical community, adjust to people's needs. We can't do this one size fits all, that urban areas have access and a lot of rural areas do not have access. Yes, sure, insurance was an issue for a group of people and still remains an issue for some, but it doesn't answer all of our questions. And so just picking your specific argument and not recognizing that America is a very diverse country with a diverse set of needs. And what I'm telling you, the
How
data...
will RFK Jr. make it better?
RFK is already making it better by having a frank discussion about healthcare needs in this country and the level of chronic disease and the fact that our food has all of these additives, which we know now. I mean, I'm sure you support the fact that the gut microbiome is critically important. And we've been abusing our gut microbiome for decades with these food additives. And now we know that our gut microbiome, which none of us in the 1980s when we were trained really paid attention to, he's waking people up to that issue of food, gut microbiome,
well, let's talk about food. I mean, really
okay, well, hang on. Let me bring in, we've got two other guests. Let me bring in Brian Johnson. Brian, great to see you again on Uncensored. We had a fascinating interview a year ago or so. This is all in your wheelhouse because you've gone on an extraordinary personal journey about health. First of all, what is your assessment of the state of America's health right now?
Yeah, I think the backdrop to all of this that's really important is that AI is advancing at a speed that is unfathomable to our current minds. We are bringing online the equivalent of billions, if not soon trillions of hours of PhD level intelligence, human intelligence, to find new discoveries about health and wellness and things that can improve our lives. And this cannot be understated. So as much as we want to debate an individual and their ideas, in the backdrop, the technological thrust and movement forward is just really the most powerful force in the entire world, that it will transform the way we think about health and wellness. I mean, over the past couple of years, I've become the most measured person in human history, proving that you can, in fact, measure the biological age of your organs in a robust fashion. We can begin doing this for a very large number of people. So I think we're at a turning point in terms of the way we think about health and wellness, where instead of responding to symptoms, we can actually get ahead of it. And I think it actually answers a really important question. What is the West fighting for? I think it would be pretty cool if America said, we are going to become the healthiest nation on planet Earth, that we're going to have the longest lifespan of any country in the world. It's a really bold endeavor. It would be something that we could lock in onto. I think everyone benefits from positive health.
And what about RFK himself? Do you think he's a force for good, or are you worried about some of the stuff he does and says?
He is an atypical person in the job, and there's a mixed level of opinions of his, but that's true for anybody. If you bring anyone into this position, there's an easy way to take them down. He's well-intentioned. He has different ideas. I think ultimately, at the end of the day, I think he will respect science. I think he will move forward with science, and I think that he'll be good for the health of America.
Okay, Grant, you've been very patient. Thank you for that. You're a big fan of RFK. I've got to say, I like him personally. I've enjoyed interviewing him. He's a very smart guy. That is without any doubt. I think he's a smart guy. He's a big thinker. And frankly, I always say to people, I've been saying this a lot recently, if you look at pictures from New York or LA or Miami or anywhere you like from 1920 and you compare them to today, what do you see? No fat people. Right, you just see a bunch of fit-looking people, albeit with a smaller health span expectancy because of disease and so on. But Americans, like the British, have just got very fat and immobile with all the disease that comes with that. They're eating crap food in the main and so on. And here you've got a guy, RFK, who's 70-odd. He looks very fit himself, so he practices what he preaches. And he just wants to think differently about what America is doing to itself with food. I mean, that alone, as Deborah said, I think is a good way to start, isn't it?
Hey, look, I mean, all you got to do is look around the country, just like you said in your opening, 355 million people. Most of them look older than they are. They're definitely overweight. You got autism breaking out in this country at great rates, infertility, sperm counts down, infant mortality goes on and on and on. Anybody that does not want to confront that with new eyes, like your self-described journalists down there in the red, It seems to be here just to antagonize, not solve a problem.
Francesca Fiorentini is the only one on the panel actually hitting the core issue here: health insurance. While the likes of Grant Cardone dodge the real problems, focusing on everything but what matters. Remember, this is the guy who apparently said making less than $80,000 a year means you're a loser. That's where his head's at. So it's no surprise his approach is to blame people for their own health problems. Sure, we all agree lifestyle choices like poor diets and lack of exercise contribute to health issues. But the fundamental problem is access to affordable healthcare, something Francesca is pushing for, and these other panelists are just ignoring. They won't talk about making it cheaper to see a doctor or get emergency care because they don't want to confront the actual costs of healthcare. Think about it. Even someone like Brian Johnson, who could afford almost any medical emergency, could still find himself in a dire situation through no fault of his own. But what about the average American? Even with insurance, a serious accident or illness can lead to financial ruin. That's the reality Francesca is pointing out. People can do everything right, eat healthy, exercise, and still end up facing massive healthcare bills if they get sick or injured. We're not seeing a genuine conversation about this in our government. It's always the same old dance around the real issues. Francesca Fiorentini is spot on. We need a comprehensive approach that doesn't just harp on individual responsibility, but tackles the systemic issues like food additives and, crucially, the affordability of healthcare. The reality is harsh. In America, you can go bankrupt simply from getting sick, and that's a tragedy. What do you think about Francesca's points or anything else from the show? Drop a comment below. And if you dig this breakdown, don't forget to like and subscribe. This is Kyle Kulinski with Secular Talk, and I'll catch you in the next video where we continue to cut through the noise and get to the heart of these critical issues.